Nothing can truly prepare you for the loss of a loved one. While grief is a natural reaction to loss, the grief process associated with the death of a loved one by suicide is often quite different to that associated with an expected or anticipated death. It is important to remember that we all differ in the way we react to the sudden loss of a loved one and in how we display our grief. There is no right or wrong way in dealing with your grief, as it is a very personal and individual experience. It is always best to do what is right for you, not what you think is expected or what others tell you. Whilst grief cannot be reduced to a prescribed formula, there are a few common reactions. Shock and denial. Initially, you may feel total shock and have difficulty believing what has happened. You may think this can't be true. You may feel disconnected from your environment or those around you, or you may even feel like an observer watching this happen to someone else. Shock and denial can act as a mechanism which protects you from the early pain of loss. Shock can affect people physically through symptoms such as nausea, sleeping difficulties, chest pain, shaking, stomach pain, and breathlessness. If you are suffering any of these symptoms, you should see your local doctor. Guilt. People who are bereaved by suicide may experience feelings of guilt. You might replay what if and if only scenarios in your mind. It's important to remember that the level of support you offered to your loved one was based on the understanding you had of their situation at the time. Anger. Anger is a necessary stage of the healing process. Be willing to feel your anger even though it may seem endless. Denying your anger can be far more damaging than letting yourself express it. Finding a way to do so in a safe and non-destructive way is important. Depression. Most people at some time or another have felt depressed. However, depression becomes a serious illness when the mood state is severe, lasts for 2 weeks or more, and interferes with your ability to function at home or at work. If you are concerned that you are experiencing depression, you should consult your local doctor. Reach out for help. Reach out to loved ones for comfort, understanding and healing. Tell people that you need to talk about your loss. Friends and family may be afraid to bring up the subject for fear of hurting you. Balance your need for company with your need for time alone. Be prepared for painful reminders. Anniversaries, holidays and other special occasions can be painful reminders of your loved one. Do not be hard on yourself for being sad. Consider changing or postponing family traditions if you find them too painful. Don't rush yourself. Losing someone to suicide is immensely painful and healing may occur at its own pace. Do not be hurried by anyone else's expectations that it has been long enough. Expect setbacks. Some days you will feel better and then find you take a step backwards. Be gentle on yourself. Healing does not happen in a straight line. Consider a support group for families affected by suicide. Sharing your story with others who are experiencing the same type of grief might help you find a sense of strength. If you are concerned or overwhelmed by the way you are feeling, or if the pain of loss is so constant and severe that it keeps you from resuming your life, you should always consult your doctor or a mental health professional. Please visit our website for more information on this topic or support services available. www.mentalawarenessfoundation.org